I'm Dr. Paulina, GP and aesthetics doctor, and I wanted to show you how to put on and take off surgical masks because I've seen a lot of people wear them occasionally incorrectly, which is unfortunately a bit of a waste of a mask. This mask I'll be wearing later on at work today, so it will not be wasted, I promise. Just kind of a comment about masks. They're not actually recommended to be used in public, at least in the UK. They're more designed to prevent the spread. So if I was to be ill and cough, that will keep all my bacteria hopefully in. It's not actually to protect you from other people. And the reason is that when we breathe in and out through the mask, it's got all the nice moisture from the air that we breathe out on it, and that's actually perfect medium for the bacteria to grow in. Some studies have shown that it's just so contaminated and catches so many bacteria, you're better off not using it in the first place. And also it can give you false sense of security, and if you put it on and take it off incorrectly, you can actually become more contaminated, especially if you were to wash your hands and then take the mask off after, and then actually with your clean hands you touch the mask and then all the bacteria is back on your hands again. So my mask and most masks will have a different top and it's a bit more rigid. So the idea is that you put it over the nose, and I've seen a lot of people put it under as well, so you have to put it over your nose and really seal it tightly, so like that. And then tie it at the back of your head. That's where the bare below the elbows that I've described in my previous video comes in handy, because you can tie it under your, so you're tying it under your ponytail if you have one. So a nice tight seal. So I do it like that. So you find that a lot of masks, if you put it over your ears, they'll ride up to your eyes. So that's why it's good to tie under your ponytail or at the bottom of your head. So it forms a really nice tight seal around there. And then the bottom of your mask, you need to spread it over so it covers all nice here and goes nicely under your chin. And then if you've got a ponytail, it's really handy to put it over like that. I don't unfortunately have a mirror in front of me, but I hope it all makes sense. Okay, so one goes under and one goes over, and this is as tight seal as you can get with a surgical mask. And the difference of between this one and the FFP3 isn't actually that much. The main bit is about the seal. So if you're not putting this one correctly, you're actually wasting it. So if I want to take the mask off, ideally you should never be touching the front of the mask. You just have to touch the back, and ideally you actually rip the back of the mask and lean over a bin and let it fall off, or just pull it away from your face and throw it away. But as I said, I don't want to waste this mask and I will be using it later, so I will just untie it. If I can find it, and then take it off. Take it off and put it away. So you do not want to touch the dirty area of the mask. And then the best way will be to wash your hands, which is what I've covered in the other video. So always take the mask off first and then wash your hands. So I hope you found it useful. I've done another video about washing your hands and when to use alcohol gel. So please feel free to share it to your friends, and stay home and stay safe. Bye.